Welcome to The Better Life with Dr. Ann Pinkston. Join Dr. Pinkston today as she teaches you how an integrative approach to health, combining holistic and contemporary medical information, can lead you to the better life. And now, here's your host, Dr. Ann Pinkston.
Hello, everybody. I'm Dr. Ann Pinkston, and this is The Better Life with Dr. Pinkston. And today, I'm going to feature Ray Solano from up in Cedar Park, Texas with PD Labs, and we've got a great topic for you because we see a trend, don't we, Ray? We see a trend of people taking on some need for self-care. Maybe people feel like they're not getting the care that they need out there, but I think some corporations have made it a lot easier for people just to jump on, run through a checklist, and then receive a prescription all tidied up with a bow on top in the mail, and don't really get a lot of guidance. And this has been a trend for a while. I think there's getting ready to be a crackdown on it. Is there some changes coming for us, or what do you think about all this?
Well, yeah, I'm glad. Thanks for having me on today. And I think, the purpose of our show is always to give education and give real world advice to all your consumers. We're seeing a revolution in the healthcare delivery method that started with COVID because everything was shuttered down. And since then, it has evolved. And so people want to be able to get health care. So there's this shortcut that is going through for health care that we've never seen before. And I always look at it as I call it the Amazon effect. It's the Amazon effect for healthcare. You want everything instantly. You want it in 2 hours, and usually sometimes you can get something in an hour. So what has morphed from here is sometimes some of these traditions or these have been in place because it's not as simple as that. Everybody is a little bit different. There is some unique things to healthcare, and you have to sometimes view the patient. You may not be able to see you have to see them, but you have to sometimes physically see them as well. Absolutely. To really help people. So you can't really hide behind a questionnaire. You can't really sometimes have something over a telephone, but sometimes you have to be able to see people in person or develop a relationship with them. So that this is what has happened. So what has occurred is an abuse of some of these drugs. Ketamine has been abused. We're seeing hormone anabolic steroids, testosterone abused, and with many times other pharmaceuticals being abused. The one thing I can't believe sometimes. I watch television just for the shock and awe of commercials as to how much companies are willing to take some of these healthcare ads too. And when we see these emergency kit that you are self-diagnosing, if you have this pharmaceutical medicine chest that you can treat anything. You can treat your parasites, you can treat viruses, you can treat whatever. And it just blows me away that I just think that there's many times we are going to uncover some serious conditions. It could be a heart attack that people are having. It could be underlying diabetes. We could see so many serious conditions. Absolutely. That we could be putting a Band-Aid on. So sometimes, you really, it's not that easy. So I think it's really important that we need to reframe these telemedicine sites.
Absolutely. I'll tell a brief story about an actual experience with a patient who called and said, I've got a cough, a little short of breath. Can Dr. Pinkston call me in a Z-Pack? And we were like, no, you need to come to the clinic. We need to see you. I need to listen to your chest and get a good look. And he was extremely angry. Well, I'll just go to one of those teleboxes, our telephone, telemedicine type, and I'll get it from there. So he called about a week later and told my staff, I made a huge mistake and I owe you an apology because I wound up having congestive heart failure. And Dr. Pinkston would have caught that had I listened and come in as I should have. And he said, I've been in the hospital, very sick and almost lost my life because of it. And I said, this is the absolute precise example of how that works. And I think people forget sometimes. I know there's a lot of information out there. Some of it is reliable, but, you can get a lot of test kits now that you can test your blood and, use reference ranges for interpretation. But people forget there are years and years and years, decades now of science. Somebody like me and like you have learned underneath that has to be applied and applied individually that you don't know and you can't get from, a quick telemedicine visit or chat GPT or something like that. So I think this is you brought this up as a great topic, and I think it's extremely important. Well,
and you just came back from Las Vegas, and you spent 3 days in very intense classroom training by some of the world's best experts. And it's a lot of work. It's a lot of material. You spend a lot of money, and you're doing it for a reason, to improve healthcare for patients. So this is unprecedented. 50 years ago, this was not something that was available. But there's a whole different tier of graduate level physicians for continuing education that are uncovering solutions for chronic conditions and also for preventative medicine and longevity medicine. So many times you have to, by the way, before you do all this, you have to screen for those congestive heart failures.
That's right, exactly.
Screen for serious high blood pressure, serious blood glucose dysfunctions, or it could be underlying cancers. So this is not something to play with. So you need a physician relationship that you may be able to do some telemedicine with, but they have a good foundation of knowing your history, of seeing you can look at your eyes and look at your skin color, sometimes your voice. It makes a huge diagnostic, even if it's remote. So I think it's really important for all your listeners to cherish you and the way that you practice medicine.
Thank you.
Because definitely the results are positive.
Absolutely. And I saw another commercial not too long ago from a large company. I'll keep it nameless. It's not necessary to name anything, but a very popular tennis player was on stating she lost 30 pounds by using one of the GLP medications, peptides, and that all she did was just fill out the form and got the medication. And at the end, her statement was, "This is healthcare." And of course, my poor husband, has listened to me go off over and over every time I see that commercial, in that this is not healthcare. It's health privilege, and that is different from healthcare. Whereas, she is an individual that has been in great shape for a very long time. She knows how, as an athlete, knows how to eat right and exercise and do all these things. It's much easier for her because she has a great support system and a good amount of money. And thank God for her. That's wonderful. But it is not what everybody has access to. And healthcare, I believe, is sitting, as you have stated, in front of somebody, be able to touch them, listen, hold their hand. And even if it is telemedicine, spend time, get a good history, see them again and follow up on those issues to make sure we're getting somewhere with it. There's just a whole different level. So when somebody uses a word like healthcare, I tend to be a little picky about how they use that. It's not correct.
You're not going to the gas station, picking up a drug and going from there. It's false advertising. They've actually got a warning notice for them. You can't, that company does not make that medication.
Right.
Okay.
Right.
Somebody else makes that medication. So you're misbranding that. It's illegal. You can't misbrand that, and you can't make claims like that because that's just absolutely false. And unfortunately, you or I can't get away with that. So why should somebody else be able to do that? Now, yes, I followed her pictures years ago when she was playing, and you could tell she was having a problem with her blood sugars and weight. It was occurring, especially post-athletes. They always have a completely different metabolism post workout when they go to normal, because they're able to eat anything. But when you have most of the athletes, we see them in the Laval Performance Health Center, they believe they don't have to worry about their foods.
Right.
And that's unfortunately, they say, well, they just burn it up. Well, guess what? Many of these athletes are very ill underlying. And so when they stop training, guess what? They even get worse.
Absolutely.
So there's steps 1 through 5 before you may be able to use one of those pharmaceuticals. So we're glad that, we practice integrative medicine to get to the root cause of it, and then layer it one step at a time.
Absolutely. And you touched on a little bit of the history about how this came to be, but I know you also mentioned before we went on air here about there's some government changes, some crackdowns coming. What changes do you see coming to this new field that everybody's enjoying?
Well, I think the couple things that are happening, we think the proper regulation of peptides is going to go back to state licensed pharmacies within the next 3 weeks. Mm-hmm. Right now, they have announced that they created their own black market. So you have a black market of counterfeit pharmaceuticals. You have a black market of counterfeit peptides. So in my history of practicing for 50 years, I have never seen the proliferation of medications that you have no idea where it came from, what the source is. Maybe some of it, how much of it is counterfeit. It is a black market. So where there's a black market, you're going to have money that is people in this industry that should not be in it. So it's really important now that, unfortunately, until that you're going to have to be aware. You're going to have to ask questions. Speak to your pharmacy or wherever you're getting your medication. Speak to your physician and ask those questions. Who, what, when, and where? Where did you get it from? Tell me a little bit about your business. Tell me and realize how long you've been doing this. So it's all those hard questions. But you know what? Some people don't really care, but gosh, we were seeing there's more emergency room visits that as a result of these GLP medications because of overdosing, wrong misuse, gallbladders. The list goes on and on and on of people having adverse events. So they don't want to talk about it, but and I will, that it's common.
Yes, it is. And people are very, very definitely have a very strong desire and almost desperation, in the weight loss department, and the GLPs have really exposed, I think, a lot about the differences between, pharma and then compounding, but also in what peptides are in general, and the door shut on peptides for some time now. Thank God that's beginning to open again, because I don't think they realize when they do shut the door on something, when people are exposed and they want what they want, they'll go to any means necessary to get their hands on it. And that's when the counterfeit market explodes right there, because then they have a market. They have a place to open up, make some big money. And you're right, the detriment to health. It's very, very important that people understand where they come from. Yeah. Death. Just little very, very serious situations we've seen.
Well, we put a lot of these resources on our website. You can check it out, pdlabsrx.com. And we put a number of articles, research, some again, many of our podcasts. So we can really filter on what the true stories are. And I think it's important to have those places that you can fact check what the real story is. And, that's what we do. Right.
And do very, very well, I might add. And I'm so thankful. And we've done a long time, right? You have. It really, you've been such a blessing to so many. And that's why you and I align. So we definitely need to talk a little bit probably about the peptide market. Things are going to shuffle around again a little bit. I think there's been some great news lately that it's going to open up, and that will make us safer, hopefully a safer lane for all of this. I think we will take a very short break and come back and talk about peptides. I know people are anxious and excited again. I know I am. We need them. So we'll take a short break and be right back.
All right.
Hi, this is pharmacist Ray Solano with an important tip to save you money on your prescriptions. Imagine affordable medication and programs that get rid of the root cause of chronic conditions, such as elevated blood sugar, blood pressure, and difficulty remembering your keys, or maybe even where your car is. PD Labs Pharmacy is a special compounding pharmacy providing service, solutions, and access to on-site trained telemedicine staff available to answer your questions. Today, many people have discovered personalized prescriptions tailored to you with powerful results such as feeling better. Check out our website, pdlabsrx.com. Our nationwide coverage and 26 years in pharmacy allows us to offer medications at almost half the price of local pharmacies. Switch your pharmacy to PD Labs and experience the real service without the expensive bill. Call us at 888-909-0110. That's 888-909-0110 or pdlabsrx.com. Remember, you have a choice in healthcare.
That choice is wonderful, and that is Ray Solano that is joining me today from PD Labs, and we're talking about very controversial issues regarding getting your health care. And I love that Amazon effect. That's absolutely perfect because that's where we are. But there's been some good news lately. I think you mentioned I had been to Vegas and learning, trying to finish up my fellowship now so I can advance my education. And one of the things that I'm doing too is the newer peptide certification. I've already peptide certified, but now I'm doing, updating and doing the newer courses. And I know there's been some great news in the last week or so that peptides are coming back, but what are they and why is that so exciting and good for us?
Well, the important thing is there's over 1 million doses of these specialty peptides that have been injected over the last, 8 years, and the list of side effects is so small. It's a fraction of the side effects of what GLPs. So the safety is unparalleled. The biggest safety concern is the supply chain that is out there. And that's part of this drug supply market that was created because of the restrictions the government has put on it, created this market. So we feel very strongly that the time has come, and within the next 3 weeks, we're going to have more state licensed pharmacies participating in these unique 14 new pharmaceuticals that will be useful for miraculous changes in care. We're talking about ways to reduce inflammation. We're talking about ways to turn back the clock for some of these chronic, many of these chronic conditions. And the list goes on and on and on. But somebody has to be trained on it. And you've been doing it for a number of years. This is a 5-year course that we have all gone down for peptide therapy. You just don't start. So you're going to have to start looking for people that are practitioners that are using these protocols, these doses, and we're going to even make it easier. We're going to come out with a topical transdermal, the first one of a kind, that make it easier that you don't have to do injections. So we'll be rolling that out in the next 4 weeks, and we're just going to make it easier.
That is fantastic. So which ones are you using? If you can talk about it, we may be at a non-disclosure point here.
The big ones, the BPC 157, this Kisspeptin, Semirelin, DSIP, MOTC, these are all alphabet soups for most people. But the ones that have been out there for quite a while to improve growth hormone,
absolutely,
to increase mitochondria upregulate,
absolutely,
increase melatonin production for sleep, and to signal the body to heal because they have an inflammation as opposed to non-steroidal anti-inflammatories. So once you go down this journey, this cocktail of peptides, it makes people be able to improve their quality of life. And that's what we're trying to do.
Absolutely. And safely, because a lot of these things that are now going to enter the market again are not new. They have been around for such a long time. And so the problem is, I think that it's considered more of an integrative therapy, which has been sidelined, and quieted for so long. But also they're on the market, they're off the market, they're on the market. And I think that gives a picture that maybe they're not safe because they're on and off, and nothing more could be true. I think it's more of just, who is going to be in control and, who can make the dollar, from it. I think that's part of it. And so luckily now there's been a great fight, and you guys have been a part of that. The compounding world and the integrative world have been a great part of that. And we appreciate that very much, because this is true, customized, wonderful, medicine. This is what we're in this for.
That's right. Oh, good. Well, check out labsrx.com, and we're here to help. And if you're going to any of, check out some of the trade shows that we're going. We're across the country, and we'd be happy to meet with anybody face to face. If you're in the area, stop by.
Absolutely. And it's great because you are national here. And, I always say you're from the Austin, Texas area, but you are not just Texas based. You have national capability, and it's wonderful. So
that's right.
Good. I want people to know that. So yes, pdlabsrx.com. You can also go to my website, drpbetterlife.com. Catch some of our previous shows. We talk a lot about the peptides, both the injectables for weight, but the others. And there will be more of that to come. Talk about a lot of things, men's sexual health. Ray, we've done so many, and I love it. And I appreciate you for that very much. So we will catch you again in about a month. Is there any last word? Anything that you have left over that we've missed?
Well, I think it's really important to see all the new specials that we are doing. We realize there's an affordability for patients, so we want to make sure that we give the best value for patients. So if you have some special situations, feel free to give us a call. Absolutely. Compounding is wonderful for that. It really is highly customized dosing application. There are people who can't take a capsule, for instance, who need to switch to a cream. And, you've made all of these wonderful changes in your skincare line, too. I want to make sure people know about that. We got a lot of views on your skincare. Last recent. Loved it. So, yeah, I'm using it, too. If I look younger, that's why. Prescription strength. Yeah, prescription strength. I've been doing it for 10 years now, and And it makes a difference. And I think men finally need to take care of their skin.
Thank you.
I say the Marlboro look is gone.
Exactly. I agree very much. Thank you for that. So we can do that for you. Just reach out. Anybody. I love it. Well, great. Well, thank you, Ray, again. And we will see you in a month. And everybody, have a great week. And please take care.
Take care. All right. Bye.
You've been enjoying The Better Life with Dr. Mary Ann Pinkston. For more information, go to drpthebetterlife.com. That's drpthebetterlife.com. And listen next week for The Better Life with Dr. Pinkston.